Okay, thank you, Chair. Well, okay. The objective of the study is to build a simulation model of bovine leukemia virus, BLV, in a farm in order to help decision-making on BLV countermeasures. BLV is a causative agent of enzymatic bovine leukosis, EBL, which is one of the notifiable livestock diseases in Japan. And about 40% of dairy cattle and 30% of beef cattle in Japan are reported as BLV seropositive. And the number of reported cases of EBL is increasing year by year. A lot of BLV countermeasures are listed on the guidelines for hygiene management against EBL, but for effective BLV control, we should consider that which countermeasures should we prioritize. In this study, we built a BLV infection model to help decision-making on BLV measures. The final objective of the study to make indices for the effectiveness of BLV countermeasures, such as chronological change of BLV prevalence, or economic loss due to BLV infection, or cost effectiveness of BLV countermeasures. This is the structure of the model. And first, initial herd was made, and second, the changes in the herd was simulated monthly. Initial herd was made based on a real dairy farm in Hokkaido. By testing the all-delivered cow, 7 of 48 of the all-delivered cows are known to be BLV positive. This farm didn't use common ranches and didn't introduce cattle from other farms. The data for heifers and calves were made from the data of delivered cows. Finally, 73 cattle, which include 7 BLV positive cows, were set as the initial herd. And the change of the herd was simulated. The simulation was monthly, and the period was 60 months. The simulated items are follows: a change of the number of cattle by birth or death or slaughter or sale. And for the newborn calves, 6 of them, and for female calf, whether it will be a replacement cow or not. And change of milking status and parity, BLV infection. In this study, infection by blood-sucking insects and by rectal palpation and vertical infection were considered. Change of BLV infection status, asymptomatic to persistent lymphocytosis and persistent lymphocytosis to EBL. Probabilities of BLV infection by blood-sucking insects were set as shown in the table. Insects transmitting BLV, such as tabanids or stable flies, appear in summer to autumn in Japan. So in this simulation, probability of BLV infection by blood-sucking insects from July to October was set from 6.85% to 0.02%, and the other months 0%. These probabilities were based on counting of tabanids and stable flies at a farm we conducted, and BLV horizontal transmission parameter from Tsui et al., a study of BLV infection in cattle in Japan. And next, probability of BLV infection by rectal palpation was considered as follows. And chances of BLV infection by rectal palpation were divided into 3 groups: health check after deliveries, and artificial inseminations, and pregnancy diagnosis. Health check, if the cow was diagnosed as pregnant in, when a heating of a cow was found, artificial insemination was conducted. And if the cow was diagnosed as pregnant in first pregnancy diagnosis, and second pregnancy diagnosis was conducted on the next month. If the cow was diagnosed as non-pregnant, artificial insemination was conducted again. And 1 and 2 after the deliveries, health checks were done. Health check conducted twice a month, artificial insemination was twice a day, and pregnancy diagnosis was twice a month. Rectal palpation was conducted only when there were cows in each group. Cattle rectally palpated immediately after an infected cattle is assumed to have a chance of BLV infection. Probability of BLV infection by rectal palpation was set to be 0% if a farmer used single use of plastic sleeve, 90%, almost 30% for multiple use of plastic sleeves. Probability of vertical BLV infection is dependent on BLV infection status on dams. When a dam was not infected, the probability of vertical infection was 0%. When a dam was asymptomatic carrier, the probability of vertical infection was 9.5%. When a dam showed persistent lymphocytosis or EBL, the probability of vertical infection is 48.3%. And this table shows other parameters in simulations, but you don't have to remember the parameters. I show the table to just show the references of each parameters. Parameters refer to previous study in Japan or research reports from Dairy Association in Hokkaido, the areas the simulated farm locates, as long as possible. And probability of disease progression was assumed arbitrarily, and assumed probability of progress from asymptomatic to persistent lymphocytosis as 0.63% per month, which means 31% of persistent asymptomatic cattle show persistent lymphocytosis within 5 years. And the probability of progress from persistent lymphocytosis to ABL was set to be 0.029% per month. This was is the probability that 1.7% of persistent lymphocytosis cattle show ABL within 5 years. Probability to detect ABL cattle was derived from a previous study of BLV infection in Japan. And for osteocycle, it referred a paper, and parameters related with reproductivity were derived from the report of the dairy test records in Hokkaido. And proportion of female calves to be replacement were derived from the reports from the Agriculture and Livestock Industries Corporation. And proportion of cause of death and age of death and age of throttle was calculated based on the reported cases of Holstein female in Hokkaido. And this is the result. And this figure shows the change of BLV preference in one simulation when the farm was assumed to use one plastic sleeve for one cow. X-axis means the month in the simulation, and here is the state, and here is the end. And Y-axis shows the number of the cow. And the change of BLV prevalence shows the strong seasonal effect due to infection by insects. And in this simulation, only one cattle was vertically infected. And BLV prevalence increased twice after 5-year simulation. This figure shows the change of BLV prevalence when a farm was assumed to use one plastic sleeve for multiple cows. And you can easily show that the number of BLV infected cattle strongly increased by rectal palpation. This table shows the final numbers of BLV-infected cattle for 30 simulations for each condition. And when plastic strips were used for a single cow, average number of final infected cattle was 21, which was 27.6% of the total cattle. And this was about 2.2 times as many as the initial infected cattle. And use of plastic strip for multiple cows resulted in average of 38 infected cattle rectally after 5 years, and which was 50% of the total cattle. And vertically infected cattle was also increased due to the increased number of BLV positive dams in the herd. There were 55.5 infected cattle, and this was 73% of total cattle, and 2.6 times higher as many as for single use of plastic cows, single use of plastic strips. And in conclusion, we built a simulation model for BLV infection. And by the MERT model, the change of the BLV prevalence for 5 years was simulated based on the data of a real farm. And the simulation shows that BLV prevalence increased about 2.2 times after 5 years simulation. And seasonal trends due to infection by blood-sucking insects were observed. And it was simulated that multiple use of plastic strips drastically increased the BLV prevalence. And at last, the effect of vertical infection was low compared with infection by blood-sucking insects or infection by rectal palpation. And at last, I appreciate Farm A for kindly providing their productivity data and Hokkaido Research Organization for their financial support. Thank you very much.